Today, we're taking a closer look at a serious health threat that quietly endangers millions of lives in the U.S. every year: stroke. This is a true medical emergency that demands fast, accurate action. Understanding stroke can help you protect yourself, and it might even save the life of someone you love during a critical moment. In this video, we'll walk with you through the most important aspects: what a stroke is, the most common types, underlying causes, and what actually happens inside the brain when a stroke strikes. We'll also cover how to recognize early warning signs, current treatment options, and most importantly, the proven prevention strategies you can start using today. To make everything easy to follow, we'll use clear, animated visuals that break down the complex inner workings of the body into simple, understandable steps. What is a stroke? Understanding it from the start. Think of your brain as the body's master control center. It handles thinking, movement, emotions, and other essential functions. To do all that, it needs a steady, uninterrupted flow of oxygen-rich, nutrient-filled blood. But when that blood supply is suddenly cut off or drastically reduced in a part of the brain, a stroke occurs. Brain cells can start to die within just a few minutes without oxygen. That's why every single second matters when it comes to stroke. The phrase "time is brain" is not an exaggeration, it's a fact. The two main types of stroke and what causes them. There are two major types of stroke, and it's important to understand the difference, because each one has a different cause and requires different treatment. The most common kind is called ischemic stroke, and it accounts for about 87% of all cases. It's similar to a clogged pipe. Blood can't reach part of the brain because something is blocking the way. This blockage is often caused by a blood clot. The clot might form right in the brains blood vessels, often due to a buildup of plaque atherosclerosis, or it might travel from another part of the body, such as the heart, and get stuck in a brain artery. The second type is hemorrhagic stroke, which happens when a blood vessel in the brain bursts or leaks. Although less common, this kind of stroke is usually more severe. The bleeding can occur inside the brain tissue itself, called intracerebral hemorrhage, or in the space surrounding the brain called subarachnoid hemorrhage. Not only does this flood of blood damage nearby brain cells by increasing pressure, but it also cuts off the blood supply to the area that vessel used to nourish, causing even more brain injury. A deeper look: causes and what's really happening inside the brain. To truly understand stroke, we need to look deeper, not just at the surface symptoms, but at what's going on inside the body when a stroke hits. More importantly, we need to explore what actually leads to those dangerous blockages or bursts in the brain's blood vessels. Let's start with ischemic stroke, the most common type. In many cases, the problem has been building silently for years, often without any warning signs. One of the main culprits is atherosclerosis, a slow, progressive condition where fatty deposits or plaques build up along the walls of your arteries. Over time, these arteries become narrower and less flexible. If one of these plaques ruptures, it can trigger a blood clot that blocks the flow of blood to the brain. This is especially likely to happen in the carotid arteries in the neck, the major highways that carry blood up to your brain. But blood clots don't always form at the site of the blockage. Sometimes they start elsewhere in the body, most commonly in the heart. This is often linked to a condition called atrial fibrillation, AFib, where the heart beats irregularly. Clots can break loose, travel through the bloodstream, and eventually lodge in a smaller artery in the brain, cutting off the blood supply. There are other less common causes too, such as blood vessel inflammation, vasculitis, or clotting disorders, which can disrupt normal circulation and raise stroke risk. Now let's turn to hemorrhagic stroke, which is caused by bleeding in or around the brain. In this case, the problem isn't a blockage, it's a rupture. and the leading cause is chronic high blood pressure. Over time, elevated pressure wears down the walls of small blood vessels in the brain, making them more likely to burst, especially if blood pressure isn't well controlled. Another cause is a brain aneurysm, a weak balloon-like bulge in an artery wall. Aneurysms can grow quietly for years. If they rupture, they can cause bleeding in the space around the brain, known as a subarachnoid hemorrhage, which is especially dangerous. In rare cases, someone may be born with a tangled cluster of abnormal blood vessels called an arteriovenous malformation, AVM. These fragile vessels can rupture unexpectedly and lead to bleeding in the brain, often with no prior symptoms. There's also a more complicated issue: the medications we take. Blood thinners, which are often prescribed to prevent clots, can increase the risk of bleeding if not carefully managed, particularly after even a minor fall or injury. So, what actually happens in the brain when blood flow is suddenly interrupted? Brain cells rely on a constant supply of oxygen and glucose to function. When that supply is cut off, these neurons begin to struggle immediately. Within minutes, they stop working and start to die. But the damage doesn't hit all at once. The brain is divided into two zones in a stroke: the core, where blood flow is most severely restricted. Cells here are usually beyond recovery. The penumbra, a surrounding area where cells are weakened, but still salvageable if blood flow can be restored in time. This penumbra is the main focus of emergency stroke treatment. The faster doctors can restore circulation, the better the chance of saving these vulnerable brain cells and the better the chance of full recovery. How to spot a stroke. When symptoms are a matter of life or death. Be fast. When it comes to stroke, early recognition and fast action can make the difference between life and death, or between full recovery and lifelong disability. That's why the American Stroke Association developed a simple, easy-to-remember guide to help people recognize stroke symptoms quickly. It's called Be Fast. Start by noticing if someone suddenly loses their balance, becomes unsteady when walking, or feels unexpectedly dizzy. That's B for balance. Next, check their vision. If they suddenly have blurred vision, trouble seeing, or double vision in one or both eyes, this could be a warning sign. That's E for eyes. Facial appearance is also key. If one side of their face begins to droop, especially when they try to smile, it could point to a stroke. That's F for face drooping. Ask them to raise both arms. If one arm feels weak or drifts downward, don't ignore it. That's another sign of a stroke. That's A for arm weakness. Now listen to how they speak. A person having a stroke may slur their words, sound confused, or struggle to speak at all. Ask them to repeat a simple sentence. If they can't, that's S for speech difficulty. Finally, if you notice any of these signs, even if they seem to fade, act immediately. Call 911 without delay. Time is critical, and knowing T for time to call 911 could save a life. Make sure to note the exact time the symptoms began, as this will help doctors decide the best treatment options. In addition to the Be Fast signs, there are other stroke symptoms you should never overlook. A sudden, severe headache, often described as the worst headache of my life, may be a red flag, especially in hemorrhagic stroke. You might also see sudden numbness or weakness on one side of the body, confusion, trouble understanding speech, or unexplained difficulty walking. Stroke diagnosis and treatment. Every minute, more brain is lost. When someone arrives at the hospital with suspected stroke symptoms, time becomes the most important factor. Every step must happen quickly and accurately to improve the chance of recovery. Doctors will begin with a rapid clinical assessment. Ask about the patient's medical history and evaluate current symptoms. Brain imaging, typically a CT scan or MRI, is used to confirm whether the stroke is caused by a blockage, ischemic, or bleeding hemorrhagic, because each type requires a very different treatment approach. Additional tests may include blood work and ECG to check for irregular heartbeat, carotid ultrasound, or vascular imaging to evaluate blood flow to the brain. If the stroke is caused by a clot ischemic stroke, the goal is to restore blood flow to the brain as quickly as possible. One common treatment is TPA, a powerful clot-busting medication. However, TPA only works effectively if given within a specific time frame, usually within 3 to 4.5 hours after symptoms begin. In cases involving larger clots, or if TPA isn't enough, doctors may perform a mechanical thrombectomy. This is a minimally invasive procedure where a catheter is threaded through a blood vessel, often from the groin and all the way to the brain. Their special tools, like a stent retriever or aspiration device, are used to physically remove the clot. This approach can be performed up to 24 hours after symptom onset in selected patients. After emergency care medications, such as aspirin or other antiplatelet drugs, are often prescribed to prevent new clots from forming. These treatments play a key role in stabilizing the patient and reducing the risk of another stroke in the future. Treating a hemorrhagic stroke. How to protect the brain. When blood goes where it shouldn't. When a hemorrhagic stroke occurs, meaning bleeding inside the brain. The main goals of treatment go beyond simply managing the damage. Doctors must stop the bleeding, reduce pressure on the brain, and prevent dangerous complications that can follow. The first step is usually to control blood pressure, since high blood pressure can make the bleeding worse. Medications are used to quickly bring blood pressure down to a safe level and limit further damage. If the patient is taking blood thinners, which make it harder for the blood to clot, doctors may need to give reversal agents to help the blood clot more easily and stop the bleeding. In more serious cases, surgical intervention may be necessary. For example, if a brain aneurysm has ruptured, doctors can perform a surgical clipping, placing a tiny clip at the base of the aneurysm to stop more blood from entering and leaking out. A less invasive option is endovascular coiling. In this procedure, thin platinum coils are inserted through a catheter and placed inside the aneurysm. These coils trigger natural clotting, sealing off the leak and preventing further bleeding. If a large amount of blood collects and starts to compress brain tissue, doctors may perform a craniotomy, a surgery to temporarily remove part of the skull to relieve pressure. They may also drain the blood to reduce intracranial pressure, which is crucial to prevent further brain injury. For cases involving arteriovenous malformations, AVMs tangled abnormal blood vessels in the brain. Treatment depends on the size and location. Doctors may recommend surgical removal, endovascular embolization, using special materials to block blood flow to the AVM or stereotactic radiosurgery, a highly targeted form of radiation that helps shrink the malformed vessels over time. Prevention. Your best defense against stroke. The good news is that up to 80% of strokes are preventable. That means with a few smart proactive steps in your daily life, you can dramatically reduce your risk. First and foremost, managing high blood pressure is critical. It's one of the most controllable risk factors. Work closely with your doctor to keep your blood pressure at a healthy, stable level. Next, keep an eye on your cholesterol, especially LDL, often called bad cholesterol. High LDL can contribute to plaque buildup inside your arteries, increasing stroke risk over time. If you have diabetes, keeping your blood sugar under control is absolutely essential. High blood sugar over the long term can damage blood vessels and raise your risk of stroke. A healthy diet plays a major role too. Focus on eating plenty of fruits, vegetables, whole grains, lean proteins, and healthy fats. At the same time, try to cut back on salt-saturated fats and trans fats in your daily meals. Maintaining a healthy weight is another powerful way to lower your risk. Even a small amount of weight loss can make a real difference in your vascular health if you're currently overweight. Regular physical activity is key. Aim for moderate exercise on most days of the week, not just for heart health, but also to keep blood flowing efficiently to the brain. If you smoke, quitting is urgent. If you don't smoke, keep it that way. Tobacco use is a major stroke risk factor. Limiting alcohol also helps protect your blood vessels and eases the workload on your heart. For people with atrial fibrillation, AFib, a common type of irregular heartbeat, your doctor may prescribe blood thinners to prevent clots that could lead to a stroke. Finally, make sure to get regular checkups. Talk with your doctor about your personal risk for stroke. In some cases, they may recommend additional measures like medications, carotid endarterectomy, a procedure to remove plaque from a narrowed artery, or stent placement if there's significant blockage. Stroke is a serious medical event, but the good news is, with the right knowledge, you can take action that truly makes a difference. Understanding the different types of stroke, knowing what causes them, spotting early warning signs, using the Be Fast rule, and most importantly, acting quickly to seek medical care can dramatically improve your chances of survival and recovery. Even more encouraging, the majority of strokes are preventable. By managing your risk factors and building a healthy, sustainable lifestyle, you can greatly reduce your chances of ever experiencing a stroke. We hope this video, along with the helpful illustrations, has made the topic clearer and given you more confidence in taking care of your health and the well-being of those you love. If you found this content helpful, please hit the like button, share it with friends, and subscribe to our channel for more practical health topics. And if you've had personal experience with stroke or have any questions, we'd love to hear from you in the comments below. We truly value your voice and are always here to listen. Note, all the information in this video is for educational purposes only and does not replace professional medical advice. Always consult your doctor if you have concerns about your health. Thanks for watching, wishing you good health and peace of mind.